Hey, good afternoon. My name is Ali Mezer, and today I will be talking to you about occupational therapy's role in rehabilitation and disability through animal assisted therapy, or AAT. So, what is animal assisted therapy? Animal assisted therapy is the use of animals in medical profession as a therapeutic treatment to promote healing or rehabilitation of patients. Animal assisted approach through animal assisted activities, or referred to as AAAs, has become the main method of eliminating and utilizing any problems experienced by an individual in the areas of either physical, emotional, psychological, social, sensory, and environmental development by exploiting both human and animal interaction. The human animal bond is powerful. This can provide numerous psychological as well as physiological benefits, as well as increasing the human's quality of life. AAT, or animal assisted therapy, utilizes this bond by incorporating a dog, preferably, into the patient's rehabilitation therapy, whether it's in individual form or groups. This can happen in one-to-one, one-on-one therapy sessions, and it can happen in groups as well. The preferred animal assisted pet would be a dog, since they are the smartest and wisest out there. Moving on to this case study, I wanted to include this case study in here as I was doing some research about this. It showed some great, I want to say, results, because they did a study on some patients with AAT therapy and with normal therapy sessions, and the difference shown was a 0.016 p-value. I know it's kind of hard to understand the p-value in here, but pretty much this case study does explain to you that patients that often go through AAT therapy sessions are more likely to attend those therapy sessions and stay longer than those that go to your normal therapy sessions. And if you are interested in checking this case study out, I do have a reference in here. I can also send you the link privately if you do want to go ahead and take a look at it yourself. Some settings that this kind of treatment can be taken place in, such as a prison, schools, nursing homes, hospitals, airports, even your mental health facilities. This kind of treatment can take place in multiple settings. Like I said, you don't have to be stuck with just one place. Certifications. All occupational therapists must earn a master's degree for any entry-level practice. So what does qualify you to provide the animal assisted therapy? Per the Occupational Therapy Code of Ethics, practitioners must take steps to ensure proficiency, use careful judgment, and weigh potential for harm when generally recognized standards do not exist in emerging technology or areas of practice. There are ways to ensure you have the qualification to implement animal assisted therapy. Some certifications or experience that you must have would be some mentorship or shadowing an experienced animal assisted therapy clinic, or even an AAT continued education, furthering your education and becoming more familiar with that field. There are many suggestions. As I was doing some research, you can do you can sign up for pet classes. You can sign up to with dog trainers to observe and understand your dog's behavior in different environments around different people. You also must participate in hands-on workshops with experienced professionals, as well as being evaluated from a third party. Your human animal team must be evaluated through a third party. So, moving on to disorders. Patients with a variety of disorders may benefit from animal assisted therapy. Um, this is not a kind of therapy where you just have to one disorder to treat. There are multiple disorders that this therapy can treat, like autism spectrum disorders, emotional behavioral disorders, dementia, cancer, addiction, acute chronic pain, mental and physical disorders, whether you are rehabbing from an injury. Strokes and CVAs is a big one, like I showed in the case study. There are huge differences in those numbers. Tasks and treatments. Animal assisted therapy treatments involve therapeutic goal strategies and outcome measures. Like improving fine motor skills, increasing focus and attention, improving balance, greater self-control, increase your trust and teamwork, becoming more comfortable and familiar with the people around you, improved social skills. The overall planned outcome of an animal incorporated in a patient's treatment plan is the use of that animal to help build a stronger bond with the patient, and then proceed to address any challenges or barriers the patient might face. So some points of interest that I did note down as I was doing this research was actually the settings. Animal assisted therapy takes place in a variety of settings. I did address that, like prisons, hospitals, nursing homes, airports. Another one was the human tending to build a strong bond with an animal, because a dog is an animal's a dog is a human's best friend. They tend to be non-threatening, non-judgmental, so it just makes it easier for the patient to open up. Talking from personal experience, I do own a little Pomeranian myself, and they are a friend when you need them. Like I said, a dog is a human's best friend, non-judgmental and non-threatening. Another point of interest was using animal assisted therapy is just like any other specialty practice area. It requires the same justification, goals, responsibilities, and outcome measurements. Having an animal involved in this kind of therapy does not mean it can be any less. I'm not sure how to phrase this right, but what I am trying to say is having an animal incorporated in therapy does not mean it is a less of a job. You have the same responsibilities and you have the same outcomes responsible. Another one would be this form of treatment, like I said, can take place individually or in groups. If you are more comfortable by participating in this therapy individually, or it could also happen in a group form, whether that's something you're more comfortable in. Another point of interest: the fields of animal assisted education, AAE, and animal assisted therapy, AAT, cover these types of animal assisted interventions. These interventions can also be less goal directed and more casual or spontaneous. This type of intervention is designed to promote a range of other than therapeutic or educational benefits and to enhance the quality of life. So such interventions, I did try to look at some interventions on the website. However, it did not let me, it denied me access for some reason. But I did find this intervention that It's in I will have a reference link to it, and you guys should check it out, as well as the last one, the IAHAIO, which is an organization that does work with many associations and institutions that involve animal therapy. And finally, this is my reference page. I'm gonna go back to this last one, the IAHAIO. I believe I haven't put that link up yet, but I will link that separately. But this is it for now. Thank you, and I hope you enjoyed it.